So, for my main research, I did the opioid crisis in Maine. Starting right off, what are opioids? Opioids are a class of drugs used to reduce pain. Some examples are fentanyl, oxycodone, morphine, and heroin. Fentanyl specifically is the world's biggest killer. Fentanyl is a strong opioid, and a lethal dose is less than you may think and presents a huge risk to our youth. So the problem with opioids, this year alone, Maine saw 792 overdoses and 53 deaths each month. The opioid epidemic we are experiencing right now couldn't be any more apparent. According to the University of Maine report, witnesses of drug overdoses are administering Narcan, an opioid reversal drug, in about 15% of overdose casualties compared to a 4% a few years ago. The world's overall death rates from opioids have dramatically risen over the past 10 years. And beginning in 2011, the overdose death rate for all opioids was 7.3 per 100,000 people. And by 2021, that figure climbed to 24.7 per 100,000 people. This graphic is just giving you an example of how large the numbers are right now. Just to name a few, we have 12.5 million people misused prescription opioids in 2015, $78.5 billion in economic costs, and 135,000 people use heroin for the first time. So, how can addiction happen? Someone's susceptibility to addiction can depend on many factors. It can be as simple as genetics, and or if you have an addictive personality, you are much more likely to struggle with substance abuse. Other factors can also weigh in, like family history of addiction, early exposure to drugs, mental health, traumatic life events, and peer pressure. Maine's opioid epidemic came in waves, so they often talk about the three waves of addiction. The first wave being the prescription opioid medication wave, explaining that there was an increase in drug overdoses due to prescription drugs beginning in the 1990s and lasting through the first decade of the 2000s. The second wave is the heroin wave, blaming the increased deaths beginning in 2010 and peaked in both Maine and the United States in 2016. The third wave is described as the nanopharmaceutical fentanyl wave. There is a dangerously high rise in both fatal overdose deaths and deaths due to non-pharmaceutical fentanyl opioids. And according to the Maine Drug Data Hub, there is a fourth wave occurring. There's been a huge increase in overdose deaths since 2019, and they're blaming this on the pandemic. So I wanted to touch on the connection between Maine's mental health crisis and their opioid crisis. So people with diagnosed mental health conditions are more likely to get opioid prescriptions despite the increased risk they have for addiction and overdose. The National Institute of Health explains how many people with opioid use disorder also suffer from mental illness, and the intersection between the two is a really important topic to discuss. From 2015 to 2016, more than 2 million US adults had an opioid use disorder, and 62% of the 2 million had a coexisting mental illness, and 24% of the 2 million having a serious mental illness. And it's also important to note that most of those reported receiving no treatment for their conditions. This is because waitlists for mental health care have increased dramatically since the start of the pandemic. Maine struggles with mental health mainly due to the lack of access to mental health services due to shortage of mental health professionals, long waitlists, and underfunding. And then going along with that, I wanted to touch on the connection between Maine's homelessness problem and their opioid crisis. Maine has a significant homelessness problem. It has one of the highest per capita rates of homelessness on the East Coast. And Maine had 4,400 people experiencing homelessness, according to a count done by Maine Housing, and that was done in January 2022. 78 of the 1,259 opioid deaths in the state of Maine between 2016 through 2020 were people experiencing homelessness, making up 6% of the overall opioid deaths. Stimulants like meth and cocaine were listed as a cause of death in 51% of deaths experiencing homelessness. Data also reveals that someone experiencing homelessness are more likely to have untreated conditions that can increase their likelihood of experiencing a fatal overdose. So what is Maine doing about this? Maine's currently providing health insurance coverage through Maine Care to over 100,000 Mainers, with almost 30,000 of those individuals receiving treatment for substance use. Maine is also recruiting and training over 1,000 recovery coaches, increasing the number of recovery community centers and certified recover residences across the state, and developing Maine's statewide Narcan distribution program and increasing distribution program of Narcan by over 100% from 2020 to 2022. Since 2019, Governor Mills' administration has given over 493,000 doses of Narcan, which has been used to reverse 9,840 overdoses that otherwise would have resulted in death. And that leads to the question of what else we can do. Improving the opioid epidemic even more can involve a few things. So firstly, improving opioid prescribing, reducing the exposure to opioids, and reducing the overall exposure and preventing the potential misuse of prescription opioids. Increasing the overall awareness of this very real issue can also reduce potential risks. If people know what to avoid, then those more susceptible to addiction may be able to steer clear of opioids altogether. Addiction can be avoided by staying away from places where you know drugs and alcohol will be available, surrounding yourself with friends who don't use drugs, knowing how to resist temptation, learning how to cope with stress and relax without drugs, and distracting yourself with activities, exercise, and or listening to music, and just educating yourself on the topics. And that's it.